Hello, my name's Dr. Tim Alexander. You have to bear with me a little bit because I talk a bit funny because I come from New Zealand originally, and I've been in practice for 40 years and with the Florida Centre for Cosmetic Surgery for the last 20, and I'm the senior surgeon here with the most experience, 40 years. Brazilian butt lift has been in practice in America for about 15 to 20 years, and we do lots of them at the South Florida Centre for Cosmetic Surgery, and we haven't had any adverse incidences yet, touch wood. The operation takes about an hour and a half to do. It's done under general anaesthesia, and we did under general anaesthesia, so there's less discomfort for the patient, and you can't sit down on your backside for a week afterwards, and you have to wear special compression garments which we supply, and we'll give you directions as to how to find them. It takes about a month for all the swelling to go down. It's a great operation because it contours the whole body. It not just accentuates the backside, but it makes the waist smaller, gets rid of some fat on the back and the tummy. And if your skin's too loose, the tummy, like having a lot of children or even one child, sometimes you're going to need a tummy tuck as well. The only person that's not a candidate for a BBL is really somebody who's too thin, hasn't got any fat, or hasn't got enough fat to transfer. And sometimes even putting on 10 pounds on a really skinny person, that's enough to do the job. It really is. It's quite remarkable, really. I must say that when the first operation started 20 years ago, I was a bit skeptical about it. We did a few sort of semi-experimental cases here, and I was very pleased with the outcome. Some people have unrealistic expectations and expect to bring in pictures of a huge balloon of butts and things like that, but if they haven't got the fat, that's not going to be possible. So you have to have realistic expectations. A high BMI or a BMI over 35, it really is not possible to get a BBL because the hospitals won't allow plastic surgeons to do them there, and that's where the high BMI cases have to be done. But they won't allow you to do BBLs at the hospital, period. So you've got to lose some weight, get a tummy tuck, breast reduction, something before you can get a BBL done with a high BMI. If you'd like to have a consultation, in these days of the coronavirus, we're doing them essentially virtually. So you take some selfies and send them to our specialist girls and explain what you want, what you'd be desirous of, and they show me the pictures, and I discuss with them what would be the best procedure for them, and then they'll give you an answer and go from there. And if you really do want to have surgery and you're booked in and you want to talk about the case more in detail, you can do that with me anytime.